Medication is the most widely used intervention in healthcare, and medication safety is a global priority. However, the evidence shows that variation in best practice in relation to safe and effective use of medicines is widespread. One of the most critical times for safe and effective prescribing occurs at interfaces when care is transferred between professionals. When a person is admitted to hospital, it is essential to have, firstly, an accurate list of their current medication, and secondly, to reconcile that carefully with medicine prescribed as an inpatient. In the following video, you will learn 3 key steps which, if followed carefully, will improve the safety and effectiveness of prescribing in our organisation.
So, as a pharmacist reviewing a patient's medicines on admission, it's much more difficult to work out if any changes to the patient's medicines have been intentional or unintentional errors, which can ultimately lead to patient harm.
When being admitted to hospital directly from the GP or through the emergency department, I can be asked on average 3 or 4 times in one admission what medicines I am currently receiving. This can be quite frustrating and make me quite anxious regarding medicine errors.
There are 3 steps to obtaining an accurate medication history. Step 1. Print a list of medicines issued on prescription by the GP from ECR. Step 2. It is essential to check this list with a second source, as the medicines listed may have changed or stopped. Step 3. Record any decisions or changes you have made, then sign and file in the patient's notes. Print it, check it, file it. So let's go through that again. In ECR, once you have entered the health and care number and selected the correct patient, click on the GP Meds form in the medication section, then print the list. Ask the patient or carer to confirm whether they are still taking the medication listed. Medicines may have been recently started, changed or stopped, especially if the patient has had a recent hospital admission or outpatient appointment. These changes may not be captured on the ECR list.
When a reconciliation has been completed, it first of all makes it a lot quicker process because the information's available to you, but then secondly, it's a lot more accurate. It's all been checked already, so therefore you're less likely to get calls from pharmacy with corrections to be made, so it helps with time and it helps with accuracy as well.
A good discharge letter supports good ongoing care for patients coming home from hospital. Time and again, I see how reassured patients and their families are to know the hospital has been in touch, and I'm repeatedly grateful for the time and care you put into curating the medication record during admission.
In summary, to obtain an accurate medication history, print the GP Meds form in ECR, check the medicines listed with a second source, record any changes, sign and file in the patient's notes.